think a fear of change is stopping a lot of people from fulfilling their potential and just being happy. And I think a lot of it as well is like judgment. I'm scared of what other people might think, but you don't know unless you try. So that's all I can recommend, because at the end of the day, you can always go back. If you realize, you know what, this wasn't the change I wanted to make, there's so many different ways that you can go back to what you were doing. So you don't know until you try. Just take that leap of faith, and then whatever happens.
G'day and welcome to Choosing a Uni. I'm your host, Rob Malicki, coming today from Darug country in Western Sydney, and my guest today is Melina from the Australian Catholic University. Thanks for joining me.
No worries, my pleasure.
Now, before we get started, for those people watching this, if you're watching a video, I just had to do this. We're in one of the nursing simulation labs. This is where you come for your exams.
Yes.
And I just have to do this because this person here behind us, this dummy's looking a little bit inanimate. So I just wanted to spice it up a little bit, and off we go. My hair is terrible to say. Here we go. It's great to meet you.
Great to meet you too. Nice to meet you.
Thanks for joining me. So you're here studying what exactly?
Yeah, I'm studying a Bachelor of Nursing.
Awesome.
I'm currently in my second year, but I will be entering my third year in July because I'm mid-semester intake. So yeah, I can delve more into that a bit later if you like.
Yeah, let's get into it. This campus has been open since 2021.
Yes.
What made you decide to come here? Is this close to you?
It is very close to me. I am in Hills District, region, so I'm Rouse Hill based. Very convenient. I can drive to uni. I'm somebody that I prefer convenience when it comes to having to be on campus so often. So it's just easier for me because I don't have to stress about taking public transport all the time. Also, it's good because I can just pop to the shops. Like the Westfield is literally like a minute walk from here. So if I want to get myself something to eat or maybe do some shopping after uni, easily can just do that. But yeah, it's just I like that it's local for me.
So this has got to be the closest university to public transport in the country.
I think probably yes, definitely.
literally a train right there.
Yeah.
But from parking, so where do you park? I love tactical, so give me the tactical.
Okay. So there is a little, I guess, secret between all the uni students. It's this place called Warwick Lane Car Park. It's not really designated for the uni, but it's just kind of like a general consensus of where we all park. It's free parking as well, so it's really convenient. Otherwise, if you have like just one tutorial or lecture that's 2 hours, you could get away with parking at Kmart because that's 3-hour parking. Otherwise, you can even park at the Westfield shops too. You might get lucky with street parking, but it's a little bit difficult, especially during the week. But yeah, there's so many different ways. And also the train's literally across the road, so you can just take the train too.
Perfect.
Yeah.
So you're studying nursing, but before we get into the details of that, tell me a little bit about what it's like to study here on campus. So just as I walked in, you were actually a student ambassador down the front, giving out chocolates and lollies.
Yes. Yeah, so I'm all over the place at the moment. Basically, being a student at Blacktown campus specifically, there's so many different opportunities. And because Blacktown is one of the smaller campuses for ACU, there's more opportunity to get involved because things are more easily accessible. So, for example, as you saw before me giving out chocolates, that was my student mentoring job, but I'm also student ambassador as well. So as a student mentor, I help first year uni students transition into university, just helping them find their bearings and, new routine, especially coming from like high school or even international students. That's a bit nerve-wracking. So just helping them feel more supported and welcomed. And then as an ambassador, it's the kids that are just about to get into uni. So more like year 10 to 12 students, helping them choose their uni, like similar to what you do. Yeah, exactly. So I do just like expos and presentations, and then also we're responsible for like open days and stuff and really educating students on what ACU is about. So I got a little bit off topic there. But yeah.
How did you end up in those roles, out of curiosity?
Just advertisement. They come up. So everything that's posted is usually emailed to you as well.
Yeah.
So I'm someone that's very good with my emails. I always check them religiously. So yeah, always check your emails, guys. Yeah, and I saw that the ambassador job was open and I thought, oh, that's a great opportunity. So I signed up for that. And through ambassador, I kind of found mentoring because it's kind of like in conjunction. So yeah, I just kind of networked and I really enjoy it because I get to learn the ins and outs of ACU whilst also studying here too. So I feel like it benefits me as a student as well.
Yeah, awesome.
Yeah.
In your role, so this is interesting because you're obviously talking about ACU, the advantages of coming here as a student and supporting those new students as they come in.
Yeah.
What's the main thing that you hear from students as they arrive here? Is there something that they expected, didn't expect?
Yeah.
Yeah. What's the kind of common story, if you like?
I guess a main thing for what I've come across is people are surprised with how many opportunities there are in terms of like nursing and teaching and things. like the popularity for nursing at ACU specifically isn't as well spoken about in terms with other universities. So when they come here and they surprise with how much support we have to offer, how many opportunities we have to offer, it's nice and comforting for them to be like, oh wow, like I'm getting more than I thought, you know what I mean? So yeah, I guess that's like the general thing that I hear from most students.
One of the things I've definitely heard about ACU is, because it has got literally Australia's genuine multi-state university. I mean, you got campuses all over the place.
Yeah, even internationally as well.
Oh, really? Oh, yeah, Rome, of course.
Yeah, I just came back from Rome, actually.
Oh, stop. Now let's go there. Now you brought it up. So tell me about Rome.
Rome was amazing. It's hard to be back here when I just come from, because I am half Italian as well. So it's like I was in my homeland.
Wow.
But yeah, it was just great. Like you still had that like ACU atmosphere, obviously, because it's the ACU campus, but I'm just being able to experience a different culture, a different way of life, just role playing a international student for a few weeks. It was just really fun. After class, you'd go to the Colosseum or just go to the Colosseum, and we had so many, like we had community engagement, so we got to do volunteering and things. Amazing experience. I recommend, because there's so many different opportunities as well. Like I did intensively for 2 weeks. Otherwise you can do a whole semester. I think some people can do a year, but don't quote me on that. But yeah, 100% recommend. Like, why wouldn't you?
So what was the course that you did there? You did an intensive 2-week program that related to your nursing, I'm presuming?
Yes. So for a lot of the allied health students, there's one unit specifically we have to do called healthcare ethics. So yes, so it was lots of nurses, speech paths, occupational therapists, paramedics and stuff like that. And yeah, it was just healthcare ethic learning, getting more into the nitty gritty about code of conduct and things like that. So I got to do that intensively for 2 weeks. And now this semester I only have 3 units. So it takes a lot of pressure off of me, as well as I got to study it overseas in an amazing environment. So yeah.
And just to speak to this for a moment, so there are a number of large institutions that have a sort of campuses in other parts of the world. It's quite uncommon, almost unique that ACU has that presence.
Yes.
In another country, and that it's so well integrated for students from ACU to be able to go and have the overseas study experience as part of your degree, and for that to sort of seamlessly fit back in.
Definitely, yeah.
And so if you're watching this or if you're listening along, take that up. I'm a student exchange guy by background, and honestly, I can see you, Melina, you're just like best experience ever.
Yes, right? Definitely best experience, yeah.
Go do that. Go and have that experience. Let's just jump back to Australia then and talk about community, because it's one of the things that I've heard a lot from students and staff that work at this institution.
Yeah.
Particularly here in Western Sydney, you're kind of like, this is the option, or Western Sydney has a couple of campuses in Western Sydney as well.
Yeah.
But it's like, this is a very community part of Sydney, isn't it?
Yeah, definitely.
Yeah.
Yeah.
Don't know what to say about that.
No, I guess it's especially for the Hills District people. I guess it's great because you don't have to travel all the way to the city. I guess most unis are all the way in the city, and it's just not very convenient for a lot, because for some people I know, they have to go to the city and they have to dedicate their whole day to just going to uni. For me, I had the luxury that I can go and do my uni and then I can hop to work, which is like a 10-minute drive.
Nice.
Yeah, for convenience and community. Also, I think that I find a really big positive is a lot of the people I meet here are local as well. So I have a higher chance, I guess you could say, of making, like, my friendships are...
Yeah, it becomes like your professional network as well.
Yeah, like a lot of the friends that I have now are friends that I have met on my first day, and I see them on the weekends. I can easily go and chat with them after class, like at our local like coffee shop. It's just really great because I know that they're people that I can see in my future as well. If that makes sense. So yeah, I love being able to meet people and then keep them in my life. But yeah.
Tell me about that process of making friends, because I know some people who are at high school, it's kind of intimidating going out of this place you've been for 6 years. You kind of know everyone, even if you're not really friends with everyone. And suddenly you're walking into something and we're talking hundreds, thousands of students.
Yeah. Well, here in Blacktown specifically, I think it's a little bit less confronting as it is smaller. So if you're somebody that you're a bit confronted by large crowds, Blacktown campus might be better suited to you, because tutorials, there's not going to be more than like 30 people in a class. I think 30 would be the absolute maximum. But in saying that as well, what I find reassuring is we're all in the same boat. Like, we're all starting, we're all fresh meat. Even with like student mentoring, we help like do things to integrate you more into the community and make friends and things like that. Even with like student association. What else do we have? We have so many, I can't even list them all. For me personally, I think just seeing a smiling face is what kind of helps me break that ice. I know that's how me and one of my friends met. Literally, we were both confused. We couldn't look for a class, and then she's been stuck with me since. So yeah, so little things like that, just kind of, I guess, not worrying so much about what people think of you and just having that idea that we're all in the same boat. We all are kind of scared. And if we can just offer a helping hand to one another, a smiling face, then we can like work together and make friends.
Nice.
Yeah.
Love it.
Yeah.
Let's dive into nursing.
Yes.
What made you choose nursing?
So I did start doing nursing, but I've always had my heart set on medicine. I've always wanted to be in the medical field. I guess, so as I told you before, I did start mid-semester because I was studying something else previously. So then I switched to ACU, which was great because ACU, Blacktown campus specifically, offers mid-year intake for nursing. So I was able to start in July. And I just love with nursing, it's very hands-on. I'm a very hands-on learner and I love being able to like help people. So with nursing, I find joy in not only like being one-on-one with the patients, but also their families. You also create a family within your nursing team as well. Like you all have to work together. There's no way that you're going to survive a day if you're not working with a team. And I just think it's a very rewarding career. And that's something that I really want to pursue.
Can you tell me about the process of transferring in here? Where, like, can I ask where you were studying before?
Macquarie.
You're at Macquarie and
Yes.
you moved over to here?
Yes, I did.
Okay, tell me about that process of transferring, because I think, and just to preface this, I think a lot of people, particularly coming out of high school, get really anxious about this idea, like, it's for the rest of my life.
100%. Yeah.
You know it, I know it.
Yeah.
That you can change.
Of course. Yeah.
So tell me about that process of changing.
Okay. So I did something that's not typical. So I just wanted to put that out there. So for me, I got really, really lucky with ACU because I had a early entry scheme offer previously from year 12 and I was really bad. I didn't even respond to the offer. Don't do that. That's not an example of what to do. This is just my story. So what happened was I had that thing where I was like, oh my gosh, what I choose out of uni I have to stick to. And I was scared to switch because I thought I was going to be judged. I thought maybe this isn't going to be the right decision. But all I did was I rang Ask ACU and I said, hi, my name's Melina. I have an offer from early entry that I haven't responded to. I was just wondering is it still available? Because it didn't say anything on my application that it was like denied or anything. So the lady was like, let me like check in for you. And she advised me that there was the mid-semester intake available at Blacktown because originally my offer was for North Sydney. So she said, let me see if there's any availability. And if so, we are able to transfer you and take you in. And very lucky for me, there was availability and she helped me. She was so supportive. I wish I remembered what her name was. But yeah, she was sending me all these emails as to what to do. Like, ring me if you have any concerns. I guess that kind of solidified for me, like this was the right choice. Just the amount of support I got, and I wasn't even a student yet. So
Amazing.
Yeah, I just thought, yeah, this is the uni for me.
Amazing.
Yeah.
Don't stay with something that you don't like. Like,
No.
end of story. If you're not happy with it, change.
Yeah.
Like, students have choice, and you don't have to be stuck in anything for a long time. So just don't settle for it if it's not the right thing.
100%. And there's lots of even mature age students like come across and they are lawyers or doctors and then they've decided, you know what, I want to do something completely different. And they come and they're studying and they're on the same level as everybody else. So it's never too late to do something. If you have your heart set on it, just pursue it.
I completely agree with that.
Yeah.
To me, it's like this thing, like there's always doors opening. As long as you've got doors open in life, you're okay.
Yeah,
And
100%.
you can take a choice, you can change direction. But I think sometimes we have that fear of loss, like, oh, I kind of know where I am right now. It's not really what I want. I'm not really happy.
Yeah.
So we hesitate about taking that choice.
100%.
But clearly that's been awesome for you. Like, you've walked through that door and you're like, boom, done.
Yes, definitely. I think a fear of change is stopping a lot of people from fulfilling their potential and just being happy. And I think a lot of it as well is like judgment, scared of what other people might think. But you don't know unless you try. So that's all I can recommend. Because at the end of the day, you can always go back. If you realize, you know what, this wasn't the change I wanted to make, there's so many different ways that you can go back to what you were doing. So you don't know until you try. Just take that leap of faith and then whatever happens.
Yeah.
Yeah.
Fist bump.
Fist bump.
That is just like so on.
Okay.
It's so true. Like I'm so passionate about that. There's no right or wrong answer in any of it. It's like, and nobody knows what the future's going to hold. You start in one place, doesn't suit,
Exactly.
Yeah, it's just about taking the decision and moving on.
Yeah.
Trying something until you find it.
Exactly, yeah.
So what do you love about nursing? You talked a bit about like the family, being able to connect with patients, helping people. What else do you love?
I love medicine. Like, I just love learning about, like, biology, especially. I also have a special interest in chemistry too, but there's not too much in terms of chemistry aside from, like, medications and things. Also, for me, specifically, I have a passion for oncology and, like, pediatrics. So I'm hoping to, when I graduate, go to Westmead Children's Hospital and do pediatric oncology. And I've just got my heart set on that. And that's what really, like, motivates me and drives me towards it's like throughout my degree. I just love how the sincerity and the generosity. Nurses, they work so hard, and it's not a job. We can all agree in New South Wales, it's not a job for the money. You have to have the passion, you have to have the drive, you have to have the care for people, and I just love like the environment, and I love the style of work. So I think it's something that's very well suited to me.
It's funny, isn't it? I mean, because the nurses work bloody hard.
They
really hard. And look, I think it's a good thing for people to know is that, the way the shifts work, you're doing normally like it's 12-hour shift pretty much, isn't it?
And that's for night shifts, but typically it's like an 8-hour shift.
An 8-hour shift.
It's shift work, yeah.
Yeah. So sometimes you're working days, sometimes you're doing overnight shifts.
Yeah.
But it is hard work, but incredibly rewarding.
Yes, definitely.
And what I've seen from my friends who are nurses.
Yeah, 100%. And I also like how with nursing, there's also flexibility in your work schedule because there's AM shifts, PM shifts, and night shifts. If you do night shifts, which is like the 10, 12-hour shifts, it's like more like 3 days on, 4 days off.
Yeah.
So it's not like, might not be for everyone, but that's like the general idea of it. And so if, you're somebody that you can only work nights, perfect. There you go. There's always availability in nursing. Like there's so much job prospects in it. And you can also build, like you don't have to stay a nurse. You can do a CNS, a CNE. What's up? So CNS is a clinical nurse specialist and then CNE is a clinical nurse educator. You can do like management. There's so many different things you can do. You can even be a nurse practitioner. Lots of people don't know what a nurse practitioner is, but basically you're allowed to like diagnose and prescribe medications and do testing for patients without having to get the confirmation from the doctors.
I imagine that's extra qualification.
Yes, that is an extra qualification. You have to do 2 years masters after having like a few years experience.
Nice.
Don't quote me on that because it's something I'm still researching. But yeah.
Is that what you want to do?
Yes.
You're thinking nurse practitioner?
Yes, I am thinking.
Would you also consider medicine? Is that also something potentially?
Potentially. It's depending on how the nurse practitioner works out for me. I might pursue being a pediatric oncologist.
Yeah.
But I'm pretty happy with like the nursing scope for the time being.
Yeah.
Yes. But yeah, there's so many, like you can really build your career from nursing. You're not ever just stuck doing shift work. Like you can do whatever. And I see it when I'm going to placement and I see all these different, like even facilitators. So when we go on placement as students, you have your facilitator that's like marking you as you're on your placement. They were once nurses too, and look how they've built themselves up. So yeah, so many different opportunities. I just love it. Like the possibilities are endless.
I'm really glad you raised that because I think it's one of those things that until you actually get to uni, you don't realize, you just kind of think, oh, I'm interested in doing nursing. And then you step in and suddenly you're talking about facilitation and educating and, advance, almost stepping into becoming a doctor kind of
of course,
territory. The whole world opens up in terms of opportunity.
Yeah, definitely.
Off the base of this core skill.
100%. And I think personally there's a massive stigma around nurses that all they do is like they clean patients and stuff like that. And not saying that's not important at all, but there's so much more to that. Like they're not just there to pick up after the doctors. They're their own medical professionals in themselves. So yeah, I think in ACU as well, they're really good with raising awareness to that. All my lecturers and my teachers and my tutors, they've all progressed. They haven't just stuck with nursing, obviously, because they're now teaching me. Not saying that just sticking with nursing is bad in itself either. I'm just saying that you can do so much more. Like you don't have to just stick with one thing for your whole life. So yeah.
What subjects have you enjoyed the most?
Me, I love my prac classes. My prac classes are the simulation labs, and so these are what we use for like our exams because they're more confined and small, and these are dolls. The teachers can control them via their iPads, and they can make sounds, they can cough, they can vomit, yes, do whatever bodily function.
So for those people listening along, we're actually sitting in one of the nursing simulation labs, and this one's used for examinations. So this is really sophisticated equipment that you get to practice on?
The normal like simulation labs, it looks like a ward, like just a typical hospital ward, and I love it because I feel like I'm actually in the action. You do your practice, your documentation, so all the documents are like you would see in the hospitals. You're expected to basically act like you're on shift. So when we start our classes, we get our handovers and then we have to do our nursing, like our management and stuff like that. Yeah, I love it because I can actually practice my skills and then I can go and do them when I'm on placement. And it makes me feel prepared. Like I don't feel like I'm being thrown into the deep end. Like I've got a general idea. Of course, it's going to be different when you're out doing it in the real world. But as long as you've got that idea and you've had that little bit of practice, you feel more equipped to when you have to go out and actually do it. So I love those classes.
Sounds to me like it really suits somebody that loves that kind of hands-on work.
100%.
Obviously, you're learning a ton of theory.
Yeah, definitely.
But you're straight into it.
Straight into it, yeah. And that's what I love because personally for me, I'm the type of person where I struggle to understand something unless I'm actually like practicing it and doing it. So it's great because I learn my content at the beginning of the week and then I go and put it into practice and I'm like, oh, that makes so much more sense. I understand how this works now because I'm doing this. And yeah, and another great thing with ACUs, we have pre-work. So I guess like in all unis, you have your pre-readings and your lectures and stuff like that, but a little bit more structured, at least for nursing. For example, last week, our content or our topic was like diabetes. So everything was based on diabetes. And we have like micro lectures, so like the little videos that we can watch before class, so we get a general idea and we can study it before we actually learn it in class, if that makes sense. So it's great to have like base knowledge before expanding on it in class. But yeah, I really like that because I love knowing something before I'm actually going to do it, if that makes sense.
How many hours do you have to study? And it's between class, external study, prac, the whole lot, like on average per week?
On average per week, I would say me personally, I would do at least maybe 10 hours in total. That varies. It just depends on like your work ethic as well. It depends how you learn it too. For me, I'm somebody that it takes a bit to like click sometimes, and I really want to make sure that it clicks. So I'll do something over and over again until I know that it's in my head.
So that 10 hours, you're thinking about that on top of classes?
On top of classes.
Just so all in kind of
15 to 20,
15
I would say.
Okay,
Yeah,
cool.
15 to 20. But then again, it's up to how you apply yourself. Yeah, and as I was saying, like I'm somebody that takes a bit to click, so I'll like go over something over and over again. But I would easily say for like maybe 5 to 10 hours for like the average student. Again, it depends. Everyone's different, so I don't want to make any claims or anything. But yeah, it's pretty reasonable. Like I can still have a social life. I can still have a good work-life balance. It's not like I live and breathe nursing, although like it's something that I really do enjoy. I have that good separation too.
Is there anyone, so we talked a bit about, the things you love about it, and I think from that people can start to issue it if it might suit them.
Yeah.
So that's people it would definitely suit. What is there anybody that it wouldn't suit?
Yes. I personally think if you're somebody that you're not very good with, if you don't like germs, obviously, bodily stuff might not be the job for you.
Yeah.
If you're also somebody that you get run down quite easily and don't have much patience, I would maybe recommend going through a different avenue.
Okay, so this is really interesting. This is very helpful. Somebody who might be like that, like they think they're interested in sort of health, nursing, but like, blood fluids, don't want to go there.
Yeah.
Or they're just like, don't want to actually deal with human beings.
Yeah.
Which is fine.
Yeah, of course.
Any thoughts about what might be better for them?
Better for them.
Still in that sort of clinical space.
Yes.
But without having the forward-facing element.
Of course. I'd say maybe research.
Good.
Research would be really good, especially because you can still work in the labs if you want to do research. So if you don't really want to be like face-to-face with it, you still have that protection in the lab where everything is controlled in a controlled environment. Not saying that in nursing it's not a controlled environment, but things are a little bit more sporadic. Like a patient, you never know. You can't predict when they might do something.
Exactly.
So yeah, in the labs it's a bit more confined in that way.
And so like research, but then as you were saying that, I'm thinking pathology.
Oh, yeah, of course.
Pathology, right?
Yeah, definitely. Pathology.
Perfect.
What else? There's so many different things I just can't think because it's like a whole flood of them. So I'd say research, pathology. I would say even allied health. So I would do occupational therapy or maybe even physio.
Yeah, that thing where you can deal with people one-on-one, but without the overwhelm necessarily of being in a ward.
Because you can have like clinics and things like that.
Yes.
I'd say maybe even teaching if you really enjoy it, but you don't want to be in it, study as much as you can so then you're able to teach it to other people.
Yeah.
I also wouldn't rule it out either. like a nursing. Like you might think that it's not something that you'd like until you actually do it. It's like, for example, for me, I'd say I'd use like the bodily stuff as an example. Everyone thinks, oh no, I can't deal with blood. I can't deal with that. But when you're put in that situation, when it's a patient in need, you kind of take a step back and realize what's important. And you put yourself aside and you're able to care for that patient and you realize it's not really that bad. So that's something that's really fun because it's a realization that most of my friends have had. Like they think, oh, I don't think I could ever be able to do this. And now it's something they do every day.
Yeah.
So
that's fascinating, because I reckon that's probably a mental block for a lot of people thinking about it. Yeah. Oh, yeah, like I don't have to clean that stuff up.
No, but like
but you just do it, right?
You just do it. Like now I don't think twice about it. Like it's whatever. And again, like in the grand scheme of things, you think this patient, like they need your help. Yeah. Imagine how it must feel for them that they're not able to do it for themselves. Yeah. So you take a step back and you realize what's important and then everything becomes so much more manageable. Yeah. Also, you become a bit desensitized to things too because you're so exposed. It's like, oh, this is whatever. Yeah. Yeah.
Yeah, because in the end, and there's a lot of careers like that. It's not about you in the end.
No, exactly.
It's 100% not about you. It's 100% about that person who just are you.
Yeah.
That you're trying to look after.
Yes.
So I think that's a great sort of realization.
Yeah, yeah.
Because if you're motivated by that altruistic, like giving back, looking after human beings, you're going to find it hard to find something which is as impactful on a human-to-human level.
Exactly. That's why I think with nursing, it's really driven by passion and empathy as well. Like if you don't consider yourself a passionate or empathetic person, I maybe wouldn't recommend it. However, I wouldn't also rule it out either. Like you would surprise yourself, especially when you're exposed to those things, because I feel like on a day-to-day basis, we hear about all these horrible things happening, but unless you confront it and you're working with it, it doesn't really click in your head. Yeah. So I enjoy that because it really puts things into perspective for me at least. And I realize things that I thought were problems aren't really major problems. So yeah.
That's interesting. Actually, mate, as you're saying, talking about that, I'm thinking about a friend of mine who's a nurse, quite empathetic, but she's a problem solver.
Yeah.
And in fact, what she went on to do, she's no longer in that, but she went in to do, she was a surgical nurse, so she was nurse in surgery, in theatre, nurse. Yes. But the gnarly stuff. Yeah. Like really gnarly stuff. Yeah. And I tell you what, like if I ever had like something really gnarly go on with me, she's the kind of person I'd want, in that theatre helping me out. Yeah. But for her it was about problem solving.
Yeah, exactly.
It's about like trying to figure out what's wrong and how do we fix this and that and working with the doctors and in a team to actually solve complex problems.
Yeah, and that's the thing with nursing, like maybe I'll backtrack on what I said before about the empathy and passion. I'd say nurses have different strengths and everything. Like your friend is a problem solver. Someone else might be really empathetic, but we all have our strengths, and because there's so many different wards and stuff, different nurses and their strengths, they're better suited to that. For example, the problem solver, theatre nursing would be amazing for you if you're if you're someone that's really empathetic and you just kind of want to provide emotional support for people, like mental health, even aged care. I feel like aged care is something that's not really spoken about, but it's really important to have RNs in aged care because a lot of people, they think, oh, nursing, I want to get into the action, I want to get into the hospitals, but the demographic of Australia is mostly now the elderly and they're getting forgotten about. So yeah, aged care nursing is really important too. If you're someone that you just want to spend quality time with patients and improve their quality of life by just being there with them, then 100% aged care. So yeah, there's so many different things you can do and different strengths. Everyone has a role to play. So yeah.
My guest today is Melina from the Australian Catholic University, second year, nearly third year nursing student. Why ACU?
Why ACU? Great question. I just think that ACU is incredibly supportive. Aside from the logistics that it's close to me and a great timetable and things like that, I just think that if I ever have a problem, if there's ever a situation, I can rely on the university to support me and help me. And that's something that I really admire. So yeah, that's why ACU.
Last question for you.
Yes.
If you could give some advice to 16, 17-year-old you.
Oh, me? Oh, gosh.
Or may take that as a general question.
Okay, yeah.
Like, what advice would you have for a young person who's trying to choose what they're going to do? And not specifically around nursing.
Nurses, just anything.
Yeah, just broadly advice for working your shit out.
do what makes you happy. Don't worry about what your friends are doing. Don't worry about what makes money.
What's going to get you a good picture on Instagram?
Exactly. Like,
good reel,
exactly.
right?
Just do what your heart tells you to do. As cliche or cringe as that may sound, at the end of the day, this is going to be your job that you're going to do. Even though it might not be what you stick with, there's so many different opportunities, so don't stress. You just want to choose what's going to make you the happiest. So just pursue that, and then wherever it takes you, and everything else will fall into place.
Melina, thanks for joining me on Choosing Your Uni.
Thank you for having me. I really appreciate it.
At Choosing Your Uni, our mission is to make finding your ideal institution and your degree fun, easy and stress-free. So if you're looking to save some time, to discover more and to get personalised advice for every step of your journey, check out choosingyouruni.com. Our theme music is composed by Pasha Shogi and his band Flow, and this episode has been researched and constructed on Garigal land in Sydney. Until next time, have yourself an awesome day.